This is a great part of the country, there's no doubt, but not unlike the rest of the country when you look at health outcomes and then you look at them by race and ethnicity. We see significant disparities. Minorities more likely to die of some of our nation's largest killers like diabetes, HIV/AIDS, higher infant mortality rates, and certainly cancer. If we think about the reasons why we see these disparities, probably the single largest cause is what we call the social determinants of health, which are, minorities more likely to have lower socioeconomic status, live in environments that are more challenging, maybe not have access to fresh fruits and vegetables, the types of things that promote wellness, and having limited access to healthcare as well.
Healthcare is a right. And if healthcare is a right, it should be a right for everyone. So the work that we do for cancer patients should be a right for every cancer patient.
The fact is, if you're diagnosed with certain types of cancer and you're Black, you have almost twice the likelihood of dying from your cancer. This is something that we really want to remedy, and it's something that is highly prioritized in our center.
These are problems that were created over decades and centuries, and they're not going to be solved with a 5-year gift. So we're hoping that people could think about this as a transformational opportunity, a critical time in our history to change the trajectory of these disparities once and for all.
We have a very special program where we provide patient navigation for patients who've been diagnosed and get care in our MGH community health centers of Chelsea, Revere, and Charlestown. Navigators tend to be community-based workers, so they're not doctors or nurses. And what they do is they work really closely with the patients to assess what barriers they may have to coming to their medical appointments.
If they're having issues with transportation, if they're having issues with childcare, those things don't just disappear. We have to support the whole patient and everything that comes with them.
Another important program that we have is a real partnership with Boston Medical Center. So Boston Medical Center currently serves a huge proportion of really underserved patients, and they do an incredible job giving cancer care to those populations. BMC, though, doesn't necessarily have access to some of the latest and most novel phase 1 clinical trials. So recognizing that, we've partnered with BMC to make sure that we are providing the best possible access to all of these clinical trial options for these patients.
So what philanthropy really allows us to do is to say, how do we not invest in 1, 2, 3 years, but how do we think about a long-term series of investments that allow us to fundamentally test things out, but build them, integrate them into the way we provide care.
When you're building anything, if you start at the surface and you build, it'll fall apart. I'm seeing it happen down here, right? So the work that needs to be done to build the right structures, to build the right systems, so that when people do get here that need more attention, that need more support, we could actually support them. See, if they get here and nothing's here, it's all gonna fall apart.
When we see a problem that needs to be fixed, I have no doubt that Mass General can fix it.
Maybe my perception of leadership was different in my teenage years and early 20s, but as you get older, you really want to be part of an institution where they say something and they do what they say, and that's what I see here, and that's why I'm still here at the MGH.
We really have built as part of our mission to make sure that we give the best quality care to the diverse communities that we serve.
That level of commitment to excellence and equity is part of our fiber, and we want to build on that in the future.